Hello. When I mentioned that I practice functional medicine, I get many questions like what is functional medicine? How is it different from conventional medicine? And why should patients see functional medicine doctors? But let me first start by saying that as a physician, I did not know about functional medicine till I struggled with illnesses with no answers, both at the personal and at the family level. At that time, I had to do my own research to find answers, and that's when I found functional medicine. Going back to the question about the difference between functional and conventional medicine, I always like to use the iceberg analogy. As a start, I cannot deny that conventional medicine is cutting edge and has achieved major advancements in preventing, diagnosing, and treatment of variety of diseases and conditions. However, in medical school, physicians are generally taught how to identify disease and then treat it with the medication, surgery, and other procedures. Less emphasis is placed on avoiding sickness and restoring health in medical training. Consequently, when you see a conventional doctor, you are likely to leave the office with a diagnosis and a prescription, usually for a medicine that alleviates the symptoms rather than treats the root cause of your illness. On the other hand, functional medicine dives deep into the root cause of a patient's complaints and tries to answer the why. Why do we need functional medicine? Because every day, millions of people are taking medications that will not help them. For some of the most commonly prescribed medications, like statins, it's a drug that lowers the blood cholesterol. Only 1 in 50 may benefit. To add to that, the US has the highest rate of obesity and chronic diseases among the country's studies, despite the highest expenditure on healthcare. Again, we need to ask the why and dive deep down the iceberg. So, what are the principles of functional medicine? Functional medicine uses personalized approach based on genetic and individual uniqueness. It is patient-centered, meaning that it addresses the patient's goals versus disease-centered. It's about dynamic balance of internal and external factors. And it views health as a vitality and not as absence of disease. As a functional cardiologist, let's take hypertension as an example. The conventional doctor will diagnose high blood pressure and will give you a medication. Perhaps gives you another medication to lower the blood cholesterol. To be fair, he will also, or he or she will prescribe um, dietary changes like low sodium, low fat, and lifestyle changes like reduced consumption of alcohol, nicotine, caffeine, and increased physical activity. If the drug does not work, you will be prescribed a second medication, a third, and maybe a fourth medication. All of this happening in a short visit's time. On the other hand, a functional doctor will interview you for a long time to gather a complete medical history to determine the symptoms, when the symptoms began, and what may be causing them. Then the doctor will order a series of tests to figure out why your blood pressure is high, because there is a lot of causes that can cause uh, high blood pressure, like inadequate lifestyle, excess weight, nutritional and vitamin deficiencies, toxins, hormonal imbalances, chronic systemic inflammation, and many others. So, if none of those causes are addressed, then your blood pressure will never be controlled well and will lead to serious consequences or complications affecting your heart, your brain, or your kidneys. So, to reiterate, functional medicine restores health and prevents future illness by promoting balance among body systems and getting rid of things that you don't need and getting back things that you do need. So, if you have persistent and unsolved medical complaints despite your multiple doctor's visits, please don't hesitate to submit your questions or book a call with me to discuss how to recover your health and get started on your journey. And I'm looking forward to helping you.